Pelvic congestion syndrome is a relatively common yet underdiagnosed cause of pelvic and abdominal pain. This is a vascular condition characterized by dilation of the left gonadal, or in females specifically, left ovarian vein. This often results in blood pooling in pelvic veins, which may include gluteal veins, veins around the uterus, and those surrounding other pelvic organs. This results in sensations of pain, pressure, and fullness around the pelvis and the abdomen, typically concentrated on the left side, although specific symptoms may vary by individual. Increased menstrual pain is another common symptom due to the impact of hormonal changes on the vascular structures. The cause of pelvic congestion syndrome in some is pregnancy, due to increased pressure on the veins, hormonal changes, and increased blood volume. However, it's not the only cause, and there have been many people with the condition with no history of pregnancy. While ultrasound, CT, or MRI may detect enlarged pelvic veins, a venogram or Doppler ultrasound is typically more effective for diagnosis as it can measure blood flow. While a gynecologist may diagnose pelvic congestion, generally an interventional radiologist or vascular surgeon will treat it. One conservative treatment is the prescription of synthetic progesterone. Conversely, elevated levels of estrogen can increase blood flow and weaken blood vessel walls. Another treatment is embolization of the left ovarian vein. The vein valve is closed and generally tied with coils, sometimes including foam, to relieve the pain from vein dilation. However, if the root cause is a vascular compression, like in May-Thurner syndrome or nutcracker syndrome, then embolization or embolization alone may not be sufficient because it does not address this root cause. It's important for both medical providers and the general public to be aware of pelvic congestion syndrome and to differentiate it from other more commonly known conditions, such as endometriosis, PCOS, and IBS. To learn more about pelvic congestion syndrome and vascular compression syndromes, please visit whatarevcs.com.